Hi, my name is Dr. Matthew Carpenter. I'd like to take a few minutes to talk about one of the natural therapies we administer in our office that I'm the most excited about, and that's ozone therapy. Simply stated, ozone is a combination of 3 oxygen atoms. What we're typically used to thinking of with oxygen is the type of oxygen we breathe, which is O2. It's 2 oxygen atoms. And with ozone, you've had energy that's put into splitting oxygen atoms, and they've recombined into 3 oxygen atoms. There's several different ways that ozone is made naturally in the environment. One of them is through lightning. It's the reason that after we have a lightning storm or a thunder shower that the air smells so clean and things seem like they're refreshed. Ozone is also made naturally with waterfalls and waves crashing in the ocean, something about high-power mists. And my favorite way that ozone is naturally made is by our immune system, by our lymphocytes. Our own lymphocytes, our little soldiers in our immune system, actually make their own ozone in order to eradicate pathogens. We've incorporated ozone into our office for several reasons. Number one, ozone is a safe therapy for everyone. There's no known allergies to ozone. It would be like being allergic to oxygen. You'd be living on the wrong planet if you were allergic to oxygen. Ozone also has a unique property, almost kind of an intelligence, of seeking out inflammation, seeking out infection, which makes it very helpful to use in the oral cavity. There's a lot of little nooks and crannies where we get a little anaerobic infection set, and ozone actually, by the charge associated with those inflamed areas or infected areas, will seek out that area. We call it crawling, and we actually see that happen in the clinic. Ozone loves an acidic environment, and it's perfectly suited for working in the mouth. And ozone does not discriminate on what types of pathogens it's destroying. Ozone actually destroys pathogens by transforming into a peroxide once it enters the body. And once inside the body, according to the charge, ozone destroys and annihilates bacteria, viruses, fungi, and parasites. It doesn't discriminate between them, it just wipes them all out. One of the things that I really like the most about ozone therapy is that it takes very, very, very little in order to have a great, profound effect. There's an example they always give based on research, but the example is with 3,500 bacteria. And you think in order to kill 3,500 bacteria, you can use 3,500 molecules of chlorine, and it's kind of a one-on-one deal. But what they know is that 1 molecule of ozone will actually destroy 3,500 bacteria, and it does it about 3,000 times faster than you can with chlorine. So it's a reaction that works very, very, very quickly, and it's a reaction that spreads through the body. So it's wonderful. It allows us to be very conservative in our approach and have a great, profound effect. One interesting point about it is, talking about chlorine will actually damage our tissues as well. So it's not ideal to try to treat all infections with chlorine. It can be caustic to us. But with ozone, it's got an intelligence where it does not affect our cells. Our cells are intelligently covered with antioxidants, which is a marker to ozone to leave the cell alone. So bacteria, fungi, parasites, these things are not covered with antioxidants. These types of clinical and research-based facts about ozone are becoming very, very, very important in today's age, as we have tried to make more and more antibiotics to treat infection and figure out how to stop their reproductive cycles and all these things. Bacteria reproduce very quickly, and they outsmart our best technology associated with antibiotics. Ozone therapy works in a different way. If the cell is not covered with an antioxidant the way we are, it gets destroyed. What are some different ways that we use ozone in our office? We have an ozone generator by a company called Longevity. It's very important if you go into a dental office and they're doing ozone therapy, you want to know that they're using Longevity. It's the only FDA approved ozone generator. And with the examples I've given of how strong and how powerful of a medicine ozone is, you want to make sure that the dose you're administering to a patient is exactly the right dose. The Longevity is the only FDA approved machine for that right now. But some different applications of ozone in our office is we actually make, on a daily basis, we make ozonated water. The ozonated water we give to our patients, they can use it for all types of things. They can use it to treat herpetic lesions. They can use it to treat a sinus infection with a neti pot. You can put ozonated water on to treat hemorrhoids, to treat any kind of burn, bacterial, insect bite, rash. All these things can be treated safely and non-toxically with ozone water. Within our office, we actually use the ozone water and run it through our dental units. Every few years, you'll hear this thing come out in the paper of a case of Legionnaire's disease that came from a dental office. Within the dental units that we use and the water lines that we use, little bacterial biofilms form. These little biofilms are highly intelligent structures that allow bacteria to multiply and spread. And it's really a wonderful application of ozone water. We can run ozone water through our dental lines and it sterilizes our lines. Some of the other reasons that we use ozone water in the office, patients come in to have hygiene therapy. There are a lot of bacteria and viruses and parasites in the mouth. It's very, very, very simple. We'll give a patient a little bit of ozonated water to drink, an ounce or two, and then we'll have them swish it in their mouth for 60 to 90 seconds. And what it does is it brings the bacterial levels in their mouth way down. That when our hygienist is using ultrasonic scalers and instruments that rotate quickly, there's not an aerosol produced in our office that carries a lot of the viruses. So our office is a much safer environment for people to come into to pursue care. We also use ozone, the actual ozone gas, in many different applications in our office. Just a few that I may mention are when we're doing restorative work like fillings or seating crowns. We go in and remove a large mercury filling. You always look underneath that filling. The tooth is black and dark, and it's very hard sometimes to distinguish between healthy tooth structure and tooth structure that's diseased still. And quite honestly, even with good magnification, you can't see bacteria moving around on the tooth floor. We can use ozone gas at a certain gamma or microgram inside that preparation, and it sterilizes the preparation. It's a wonderful thing. It makes our restorative work last longer. It makes the nerve of the tooth less inflamed, which means that the patient's more comfortable immediately after the procedure. Plus, we have an idea based on research that we get better bonding strength if we really clean the surface that we're bonding to, so it's wonderful. We also use ozone gas to precondition a patient for surgical procedures. We have a patient come in that has an infected root canal, or somebody that we're planning on doing cavitation surgery, or just a tooth that's gone bad and the patient hasn't been in and it's got a big infection in the jawbone. We can actually use ozone gas, again, at a very, very, very specific dose. We can use that a couple times a week for weeks before we do the surgery, and what it actually does is wick that infection that wants to tend to spread out through our alveolar spaces. It wicks it back to the tooth to help make a more conservative surgery. I mean, that's good for everybody. It's less time in surgery, it's less discomfort for the patient, and in general the tissues surrounding the infection are much healthier, so we get better results, more comfortable patients, less pain. One of the side effects that ozone has that's good is it releases nitric oxide in the process of working in our bodies. Nitric oxide, you can look up, it's one of those things that they're finding has great value for good general health. Nitric oxide is great for our cardiovascular system. It sets up new blood channels. It sets up new areas of getting innervation to tissues. So it's a wonderful therapy to use in patients that have had gum disease. We very routinely use our ozone therapy in our hygiene department, and it's the difference between having to scrape and scale and mechanically debride areas, or be able to use an intelligent gas that kills bacteria prior to doing that. It makes all the therapy more conservative for a patient, which are things that we love.